So the first nerve we're going to test here is the olfactory. I'm going to have you close your eyes and plug one nostril, and then I'm going to have you identify the smell. So I have a vanilla candle, and then I'll have them close their eyes and plug the other nostril and see if they can identify the other smell. This is ammonia. Next, I'm going to assess the optic nerve. So I'm going to take a newspaper here. I'll hold that about 18 inches in front of their face and see if they can close one eye, read the couple sentences, and then close the other eye and repeat, trying to read a couple sentences. Peripheral vision, we're going to sit across from each other and close one eye, and then we'll put a finger out in the periphery, and we'll do an equal movement until we can see each other's fingers. It should be about the same placement of our hands before we can see each other's fingers. And they're going to let me know when they can see my finger, and I'll let them know when I can see theirs, and it should be about the same positioning. For the ocular motor, trochlear and abducens, we usually check these together. So we'll start by doing about 18 inches away again. I'm going to have my partner follow my finger, and their eyes should move together as I move my finger. But their head shouldn't move when they do that. The pen light will be checking for pupil constriction, and it should be immediate. So we'll try one eye, then the other eye, and watch for equal constriction in the pupils. For trigeminal, we're going to use the cotton ball, some ice, and then two different smells again. So for this one, we're going to look at the symmetry and strength of the temporal muscles. So we'll start by putting these on their temples, and we'll have them clench their teeth. To assess the mass eater, we'll put our fingertips on their jawline, and we'll ask them to clench their teeth. They should feel strong and equal on both sides. And then to test the sensory function of the ophthalmic, maxillary, and mandibular sensations, we'll have our partner, close their eyes, and then we're going to lightly touch their forehead with a cotton ball, and they let us know when they can feel the cotton ball touching their forehead. Then we'll take a small piece of ice, and we can just briefly hold it on the mandibular, maxillary, and they can let us know when they feel that, different sensations. And then again, we'll have a partner close their eyes and take some whiffs of some different smells, vanilla candle again, and they should be able to differentiate that they're not the same, or if it is the same. This is smelling salts, but obviously I wouldn't use that. But some different smells can have a cooling sensation, like if you were to smell mint. And then for the facial nerves, we'll use the cotton applicator and a sugar solution. So this will be testing the taste buds. So they will get a little bit of the sugary solution, they'll stick their tongue out, and then we can touch it on different parts of their tongue, and they can identify which part of their tongue they can taste the sugary solution. And then we're also going to have the test of the motor control of the muscles and their facial expressions. So we can have them raise their eyebrows, frown, smile really big for us. They can puff out their cheeks for me. and then we can have them close their eyelids really tightly, and we can just gently try to force their eyelids back open while they try to keep them held tight. Vestibulocochlear, we're going to use a ticking watch, so we'll have our partner turn around for this one, and we can either whisper some numbers in behind their ears. Another one that I've heard was if you just rub your fingers together like this, they can listen for that sound and tell you when they can hear it. Otherwise, we have a ticking watch. We can hold the ticking watch up to behind their ears and have them tell us or raise their hand on which side they can hear the ticking watch. For the balance portion of this nerve, we're going to have our partner spin around 10 times. So if they spin around a bunch of times, let's make sure that they don't fall or get hurt. And then when they stop, we should be able to observe and their pupils, the response of their eyes. The normal response of them spinning is vertigo. Again, we want to make sure that they don't fall down as we're doing that. Glossopharyngeal, we're going to use unsweetened chocolate. And then the cotton applicator again. So we'll use a tongue depressor. We're going to gently, first of all, we're going to check for a gag reflex and swallowing. So we'll just gently put our hand on their throat, have them swallow. We can tell if they're swallowing. And then to check the gag reflex, we're going to use the tongue depressor, which I don't have, but we'll hold their tongue down, and then with the cotton applicator, we're just going to touch the uvula in the back of their throat, and they should have that gag reflex. And then we'll explain to them what happens when we do that. And then we will have our partner say, ah, and we'll watch for the movement of the uvula in the back of the throat. For the accessory muscles, we don't need any equipment for this one. We're going to be assessing the strength of the sternocleidomastoid muscles. So we're going to put our hands on our partner's cheeks, and then we're just going to apply some resistance as they try to turn their head from side to side. So we'll try to hold it in place, but they should have good equal strength turning their heads from side to side. And then to assess the strength of the trapezius, we'll put our hands on our partner's shoulders, and they need to shrug up against the resistance of us pushing down on their shoulders. It should be equal bilaterally. Hypoglossial, this is the last thing we're going to do. So we have our tongue depressor. We're going to have our partner stick out their tongue, and we'll look from any deviations from midline. We'll ask our partner to move their tongue from side to side, and we'll use our tongue depressor to push against their tongue as they try to move it to their left. We'll push against their tongue as they try to move it to their right, and it should have equal bilateral strength moving from side to side. And that's all of them. Thank you for your help.